Mental health facilities generally got the balance right between preserving people's human rights and keeping them safe from COVID-19 during the strict lockdown. But things might have been different if the units had been full to capacity. Now, that's according to a just-released report from the Chief Ombudsman. Due to the higher risk of coronavirus spreading in places of detention, the Ombudsman decided to keep doing on-site inspections during the lockdown, visiting 5 specialist treatment, forensic and acute mental health facilities in the Canterbury and Wellington regions. Those inspections ended with 3 of the mental health units being asked to lift their game. Now, joining me now is the Chief Ombudsman, Judge Peter Boshier. Good evening, Judge. Can you tell me the 3 that were told or asked to do better, what were the issues there?
First of all, good afternoon to you, Lisa. Cleanliness, really, not having the facility in one case up to scratch. I want to balance this. Mostly they're doing a good job. And in trying circumstances, this is a report where we've actually said, well done. You've tried and you've gone to the point where you should have gone to deliver a good service. But with one in Capital Coast Health, we said that the cleanliness was not up to scratch and they had to improve.
One was not practising physical distancing, though, and that seems like a pretty fundamental, basic component to the COVID response.
Yes, well, you've already picked up on your intro the fact, what surprised me, and it's good, I must say, Lisa, to be able to have this discussion with you, because can I just take you back to why we decided we'd do this work, if you don't mind? These concerted discussions we had during level 4, how would we get into places where people were being detained and try and look-see when A, there wasn't a welcome generally to us going into these facilities, and B, we were worried, of course, about our staff being exposed to risk and even us having risk introduced ourselves. So it took a long time for us to get designated as an essential service and to go in and do it. And to me, it's fundamental to this job and this position. Even though we were in a crisis and we were having to do things to restrain and curtail liberty hugely, I just felt we needed to be in there. And so, generally speaking, we were pleased. That what you've picked up in your intro is, why were these places, admittedly just a snapshot, but why were these 5 only half full, when we'd said prior to this period, in the most recent critical report, the Henry Bennett Centre in Hamilton, it was bursting at the seams and having people having to sleep in consultation rooms. So quite why these all 5 were so half full, I'm not quite sure. I guess what allowed staff to do was retain the best interaction with patients and the best social distancing possible.
Did you ask them why they were half full, whether some people were discharged from facilities in anticipation of the lockdown, whether it was a managed occupancy rate or it was just luck that they were only half full?
That's a very good question, and I can't answer it honestly. Those questions were not put. So in the letters that we did to these facilities, and we did the same with rest homes and prisons, which we'll be reporting on, by the way, in the next week and then the week after that, we set out exactly what questions we'd be asking and what we'd be looking at. Lisa, I'm inclined to think that in order to manage the facilities, they had no choice but to allow some patients who would ordinarily be in those facilities to go into the community. I obviously hope they were well looked after.
But is that right then? In order to manage that, you discharge people who may not be, in a position to be in the community. It's not the best place for them.
The question I asked myself was, how could they do this? It's not a querulous question I'm asking and trying to answer myself, but I have mused as to why, if it was appropriate to do this during level 4 and 3, why couldn't it have been done ordinarily? Lisa, it's a good question to ask, and I don't have the answer. I'm, as I say, drawn to speculation that it was deliberately done, not just good luck, in order to manage patients satisfactorily.
What difference would it have made if they were full?
Well, social distancing, you've already highlighted the fact that what they managed to do, and we've said this by way of reinforcing and supporting how well they did do. Look, they managed to connect patients well electronically with whānau so that their connectivity wasn't lost. There was no evidence of COVID-19 in any of the places, so they managed to control infection. They managed to, by and large, run facilities in trying circumstances really well. Just the one incidence of lack of cleanliness that I outlined to you. But the good news story is that there were no major incidents that we reported on, and I'm really pleased to be able to say that.
The thing is, though, normally you go into these places with zero warning, right? These were different circumstances, so they knew you were coming. You've already identified the fact that they seem to have lower occupancy than you would normally expect. Are you sure that you got a fair representation?
Probably the answer is no, and that's the compromise that we had to strike in doing these announced visits. You make a fair point. I acknowledge that. I much prefer to simply turn up unannounced, and what you see is what you get. But I had to make all sorts of compromises in this work, Lisa, and I felt it was better to show a presence and indicate that we were still around and still a force than not do it at all. But you make a fair point that in the limited circumscribed inspections we did, they're not as good as the usual unannounced visits.
So obviously there was no visitors at the height of the lockdown. So for some 5 weeks, whānau were not allowed to visit. And the report points out that obviously contact with your family is essential to recovery. It's also very significant in terms of safeguards against ill treatment. I know you mentioned electronic communication, but were you comfortable with the level of isolation, true human contact? With all of the inspections that we did, and more to come, which just to tantalise, that's been the issue. I was concerned right at the outset that if one was going to cut off in prisons, rest homes and mental health facilities the ability of whānau family loved ones to visit, you were going to isolate and make people lonelier than they might otherwise be. I have no way of avoiding that issue, but that was the compromise that occurred. I'm pleased that when we tested to see what they'd actually done, I believe that they made a genuine, well-intentioned and conscientious effort to link mental health patients with their whānau through Zoom and other means. We're out of time, but just before you go, is the prison system going to come up as well as the mental health facilities, from what you're saying?
I'm not going to say a word other than the fact that the prisons report and the rest homes report will be pretty interesting.
All right, we'll be talking to you again shortly, no doubt then. That is the Chief Ombudsman, Judge Peter Boshier, joining us there live from our Wellington studio.